All right, now we're going to be talking about organ transplant. So there's many organs now that we're able to transplant to help save other people's lives. Heart transplant. I have a friend now that's had 2 heart transplants through the years. Liver, kidney, eyes. So what happens when somebody passes away and they're brain dead, but they still have some viable organs? How are you going to keep those organs viable? You need to keep IV fluids going through their body to make sure that those organs still stay moist, viable, until the team gets in there to get the kidney out, or the liver or the heart or whatever they're going to use, harvest it, and then get it to the person that they're going to donate that to. So it's a very fine-tuned machine on how that's done. So I'm just going to go over just a few things with this. So the person that is able to get the transplant, prior to that, they have screening done to make sure that you're not going to go through any hyperacute reaction for rejection, because that's the last thing you want to happen. It's called a PRA screen, so make sure you look that up and understand why. But it's really to screen for hyperacute rejection. You don't want to go through all this knowing that you're going to reject the organ. Okay, so these people go through the transplant, and it's very critical the first few days after transplant, because again, you're watching for rejection. Your body's like, this is not supposed to be here. I don't like this, which is why you're on immunosuppressants the rest of your life. Cyclosporin is one of the oldest ones that's been out. There's other ones out there like Cellcept, among others that I don't know all the names of, but cyclosporin's the first one. You need to be on that the rest of your life. If you start showing signs of rejection, let's just say you have a heart transplant and you start becoming winded when you're walking, that can be a sign of rejection. Maybe your heart's not pumping as efficiently. You need to get in. If it is a sign of rejection, they usually will do a cardiac cath, take some biopsies to see if it's in rejection. Then they will up the immunosuppressants and give you steroids and that kind of thing. So basically, immunosuppressants, remember, it's making your body, it's fooling your body to think that it's not a foreign thing and that it actually belongs there. So when these people go home, they need to monitor themselves. So they need to watch their vital signs. They need to take their temps all the time. And if they have any increase in temp, they need to call the doctor, because these are very fragile patients. So you want to make sure that everything's okay with that. So let's just say, for example, they have a kidney transplant. How are you going to know that it's working? Well, post-kidney transplant, all these people are going to get IV fluids, but let's say they had a kidney transplant, it's even more important to watch for urine output. You're going to watch for urine output for all of these, specifically the heart too, and because we're thinking about perfusion, but we want to make sure that this new kidney is working and that there's urine being made. Sorry, I'm just making sure I have all my notes here. Okay, so also there's contraindications to getting organ transplants. So there's been some ethical issues regarding having a liver transplant with alcoholism. So everything is tailored to the patient, but there are specific contraindications. It is on your key points, but if somebody has a malignancy that's spread, that's metastasized, then that would be more of a contraindication, because if it's spread and their life expectancy is low, it's most likely not going to benefit that patient. Or if they have chronic respiratory failure or just extensive vascular disease, they might not be a good candidate, because you're not going to get good perfusion to even a new organ. They also, these people prior to getting organ transplants, and I'm not talking your trauma patient, these people have to go through a lot of psychosocial counseling and make sure that they would be a good candidate to be able to care for themselves also. And that's it on organ transplant.